The cost of prescription drugs has been on the rise in recent years. 2012 saw a 3.6% increase. So what's behind the uptick and how can people save money? News 8's Pauline Lee looked into the issue to find out.
Well, a rise in costs for prescription drugs isn't a good thing for anyone, especially seniors. But where there's a prescription drug brand, chances are you may be able to find a generic version that should work the same way, if not better. In his semi-retirement, Patrick Killeen of La Crosse says his income isn't exactly what it used to be.
I actually have a couple of pensions from previous employers, but they're fixed.
As president of the Wisconsin AARP, he and many other members aren't too happy when prescription drug prices rise.
Most seniors are on limited and fixed income, so any component that goes up, whether it's rent, taxes, food prices, drugs, impacts them. Also, at an older age, you take more drugs. It's a larger part of your expenditures.
In 2012, drug prices rose more than twice the rate of inflation. The top three drugs, Nexium, Abilify, and Crestor, saw at least a 7.8% price hike.
The large number of generics that now are available on the market, and with less branded products being available to consumers, drug companies need to meet Wall Street expectations somehow.
Meyer says Gunderson Lutheran has seen an increase in the use of generic brands. The hospital's pharmacies fill about 5,500 prescriptions each day. About 75 to 80% of those are generic. He says with virtually no difference between generic and brand names, it could mean more bang for your buck.
Generics, if available, work the same as branded products. And in fact, in some cases, because of their lower cost, they help drive compliance to improve, and they're more affordable.
And that's good news for Killeen.
I do believe that every one of the prescription drugs I'm on is a generic.
Now, in defense of major drug companies, Meyer says they use some of the money towards research into diseases that don't have drug treatments yet. He says in the future, he does see the use of generic brands increasing, but brand names will still exist for the diseases that are hard to treat.
Thank you, Pauline. Some drugs, like the top three selling drugs, Nexium, Abilify, and Crestor, do not have generic brands. Health officials suggest checking with your physician to see if your prescription comes in a generic brand or if there is an alternative available that would be more cost-effective but would still provide the same medical outcomes.